As many of you know, the effort to transform our Cook County health system began with the publication in May of last year of a strategic plan for our health and hospital system. That strategic plan was approved in the summer by the Independent Governing Board and in October by our Board of Commissioners in Cook County. So long before I ever became a president of the board, this long-term plan was made public and was approved by both the Independent Governing Board and the Cook County Board of Commissioners. That Independent Governing Board, the vision of the board and the staff, was for a transformation of health care as we deliver it in Cook County to the uninsured and underinsured in particular. And the transformation involved a refocus of our health care system toward specialty care.
Now let me begin before I go any further that beyond a shadow of a doubt, I believe emphatically that this strategic plan is the best plan for us to be able to deliver care to those who need it, not only in the Southland, but for the entire county. As President Preckwinkle has already stated, this plan was approved by the Independent Hospital Board. It was then approved by the Cook County Commissioners and all of the entire board, and supported continuously by our new president, President Preckwinkle. Today, in 2011, and in this nation and in this state, the parameters for delivering effective health care are rapidly shifting in a world of federal health reform and the state of Illinois' Medicaid reform. All persons, but especially those with limited means, require access to preventative care and outpatient specialty care that will keep them healthy and out of hospitals. The right care at the right place, at the right course, at the right cost is a mantra for health care in our time. The emergency room at Oak Forest Hospital, which is really the end of a hallway with 4 beds in it. It is not an emergency room like any of you think of an emergency room. It does not now and never did accept ambulances. It does not take care of patients who've had a heart attack. It does not take care of patients who have had an acute stroke. It does not have the facilities for doing those kinds of things. So we're going to transform what we're calling our emergency room to a more immediate or urgent care center that will be available from 7 in the morning to 11 at night. And we will also have a clinic so that we can divert many of those patients I talked about in just a minute ago to that for a more appropriate level of care.
I'm Apostle Carl White, Jr. from the Southland Ministerial Health Network, and I'd like to say that we have met with our president, Preckwinkle, and we were encouraging her to make sure that the Southland is treated fairly in this, knowing that there was information that went out that Oak Forest was closing. After giving correct information that that's not exactly true, it's being transformed into an outpatient center that will help us to give adequate health care to the Southland, as well as partnering with other hospitals for those who might need to be put in the hospital. So by meeting with her, we have lined up with her to make sure that we could talk about this bill, Senate Bill 40, to make sure that the county could continue its work towards giving health care to Southland. We appreciate her, and we plan to work with her in getting an advisory board for the Southland so that those things that are done in Southland can have input from those who live in that area.
We're here today, I think, as we come to the close of a major effort to address the critical issues that affect our state government. As you know, our General Assembly is now in the final hours before they adjourn. There are many matters that before both the House and the Senate that affect the health and well-being of this great state of ours. However, none, I think, would be more important than Senate Bill 40, because in that bill there contain the measures that will assist our county government to provide the kind of quality health care in a comprehensive way that we need For too long, we've had health care delivered in a fragmented and, in many instances, unhealthy way. Now it's time for us to have a new era in providing quality health care for the citizens of the state of Illinois, but in particular, at this particular point, for the citizens in Cook County. Senate Bill 40 addresses that matter, and certainly we want to urge all of the members of the House of Representatives to seriously consider voting this matter up, and all of the members in the state Senate to seriously consider voting this matter up. Should they do so, we're hopeful that the bill will be signed by the governor, and it will give us the focus and the effort and the energy and the resources necessary to move forward. Thank you very much.
I'm grateful to all the pastors and leaders present for their willingness to not only hear out myself, but Dr. Terry Mason, and also to give us a hand in conveying to the communities that they serve the facts about the changes that are going to be made. And again, this is about transformation of our healthcare delivery system and a refocus on specialty care. The bill in question, which we believe may be heard today or tomorrow in Springfield, is Senate Bill 40. The folks who are with us today have pledged to give us a hand by talking to their state representatives and asking them to support that measure. And we intend to continue this outreach effort to our community leaders, our clergy, and our residents in the Southland to be sure that they understand the nature of the changes that are underway and the way in which, frankly, services will be expanded.